The ripple effects from COVID are far from over. Kids often bearing the brunt of it. Tonight, medical experts say Missouri is facing a pediatric behavioral health crisis.
Hospitals warn there aren't enough beds to keep up with demand. And News 4's Kim St. Ange is live at St. Louis Children's Hospital tonight. And Kim, that hospital has already made some changes in order to try to keep up with this.
And here's how. So Children's recently had to expand its behavioral health unit onto some other floors just to make room for all the patients, and is still at capacity. The hospital telling me it sees between 8 and 15 kids coming here per day for these behavioral health issues, and some of those range from eating disorders, anxiety, suicide attempts, and psychosis.
It's absolutely heartbreaking, and it's scarier really for the patients and their families.
Trish Lalo, president of St. Louis Children's Hospital, says they're struggling to keep up with demand for mental health services for kids. Some patients being forced to wait hours, sometimes days in the emergency room, waiting for a bed in the behavioral health unit to open, which Lalo says can increase the child's anxiety. For mom Deanna Pruitt,
they wasn't able to socialize with their friends, and especially for my daughter.
COVID restrictions made it tough for her daughter. School shut down, her dance studio closed. Socialization came to a halt. Though this statewide mental health crisis started well before COVID, nationwide, the suicide rate for kids 10 to 24 increased 60% from 2007 to 2019. Emergency room visits for suicide attempts doubled at children's hospitals from 2008 to 2015. COVID intensified those troubling trends.
While COVID-19 wasn't the issue per se, it was everything we did to control spread of the virus that we believe will have long-lasting effects on the children now and ultimately their mental health in the future.
The impact is felt at hospitals across Missouri. SSM Health says its new behavioral health urgent care has seen over a 50% increase in child and adolescent patients needing help. Lalo says there's been about a 30% increase in kids showing up to the ER at St. Louis Children's Hospital now compared to pre-pandemic. She believes partnering with other hospitals and agencies is the solution to get in front of the crisis.
Working together, I have no doubt that we can turn this around.
And no doubt that kids have definitely taken the brunt of this COVID crisis. Kim talking about how they have to go from in-person learning to virtual learning, sometimes flip-flopping back and forth. That can be really stressful for kids who crave consistency especially. So what other ways can parents get help if they think their kids have behavioral issues?
That was the big question I was asking, Sam, asking these experts, what do we do for the kids before it gets to that acute phase where they end up here maybe in the emergency room at St. Louis Children's Hospital? The good news is there are so many great organizations, so many resources that you as a parent can take advantage of right here in the St. Louis area. Just to name a couple, you have Chad's Coalition, you also have an organization called NAMI St. Louis. We linked both of those and other organizations. Just find this story on KMOV.com.